task 35. We're going to be doing an enema on a canine patient. So the first thing we need to know is the weight of the patient, and she is 36 pounds. We're going to be doing tap water for our warm tap water for our enema today, and we're just going to be doing a simulation. For her, using the 5 mg per mil or mg per kg dosing for the tap water, she would get 81 mils of fluid. So in our tray of supplies, we've got our lubricant. I've got my gloves on. We've got our catheter that I have already pre-measured 2 inches to be placed into her rectum. And then we've got a catheter tip syringe filled with, it can be filled with 60 cc's of the lukewarm water. And then we've got 81 pre-measured mils of, again, lukewarm water. So the first thing I'm going to do, and there are other enemas you can use as well, including mineral oil enemas, you can do lactulose enemas, those types of things, just depending on what the patient needs are. So the first thing I'm going to do is pull up 60 cc's. We will have to draw out the solution more than once just because this is the largest syringe I had. Put the end on this catheter tip here. Want to make sure we lube the catheter well for the patient to aid in comfort. Want to fill the catheter up mostly with the water so you're not pushing a whole bunch of air into the rectum. The next thing that I'm going to do is insert this catheter into her rectum, which I'm just going to show you what I would do. We're not going to do any invasive procedures. So her rectum is right there. Hold on, sweetie. So I would just place this tube into the rectum, as much as I've marked, which is just 2 inches for a small dog. And after that, I would go ahead and give the enema just by pushing on the syringe. Just do it nice and slow. And once I give her this portion, I would just take this off, fill the rest with water. And then insert it again, and then give the additional 21 mils. And then after, I would just slowly pull the catheter out of the patient's rectum. We would make sure that the patient, if you want to move her, the patient is somewhere where if she does defecate or have diarrhea, that we can clean it up easily. In this case, since she's a small dog, we just put her in the sink because we have those drains that catch any solid debris. And then after she's finished, sometimes they can take 15 minutes, sometimes they can, last a little bit longer. We would make sure to give her a bath, especially at least a butt bath, if anything, or if it gets on any other parts of her body before we present her to the owner, and that's it.